The doctor is in. Today it's pediatrician Dr. Courtney Sauls from Ascension St. John's Pediatric and Adolescent Medicine. Today we're talking about diaper rashes and how to treat them. Thanks for joining us.
Yeah, thanks for having me.
So it seems self-explanatory what a diaper rash is, but from a medical perspective, what is a diaper rash and what causes them?
Yeah, so the most common cause of diaper rashes are going to be babies that are in diapers. So they're constricting, they're wet, they soil themselves, and so that contact irritation is what's going to cause the most irritation for a diaper rash. And so good news is we've got a lot of things that parents can try at home to help their kids. And as a mom myself of 2 little boys, I've got all the tips and tricks ironed out for families. Yeah, well, I hope so. But I found a couple of things that have helped me in my own parenting journey that I wanted to share with our viewers that can help their kids. So I brought my little props with me. So you're going to want to use a high zinc oxide based diaper paste. That's going to really help the children out the most with that healing skin. So I brought some examples of my favorite ones. This one is called Pink Salve. It's spelled kind of funny, but it's literally pink, and it has a very high zinc oxide content, and it's very soothing to the skin. So this is my favorite one I use for my boys.
Something you can get at the store? I mean,
yeah, I get mine on Amazon, okay. And then I had them ship samples to my office so I can give them to my patients. But and this Dr. Smith's is a great option too. You can get this one, I think, at Walmart or Target. But if those are not available options, I also like triple paste. You can get that at any Walgreens or CVS. And then if that's not helping, sometimes the skin might be really raw and it's not healing well. And so I suggest parents to stop using baby wipes. That can kind of slough off of that skin. And so instead, use a little squirt bottle of water to squirt off kind of any soiled diapers, and then pat dry with a little towel, and then apply very thick diaper paste, like you're icing a cake is what I tell my families.
Oh, wow.
And then sometimes a baby might need a little bit of air dry time, so time without diapers where the air can let everything heal and dry out well with a very, very thick diaper paste.
So when they have a rash, it's not a good idea to just keep putting the diaper back on constantly.
Right, yeah, give them a little bit of air out time. That diaper can be very constricting. You'll want kind of a looser diaper, one maybe a size up, to give them a little bit of wiggle room and help to protect that skin from not having so much friction rub.
When is it time to go see a doctor, though?
That's a great question. So sometimes some rashes might not be as simple as a contact rash. It could be yeast, it could be a bacterial infection. So I counsel my families that if it's not healing after 3 or 4 days of trying these home treatments, if the skin is open and raw and peeling, or if there are really crusted spots, really large red bumps that are not getting better, or your baby has a fever with their rash, or if they're in so much pain with every diaper change, then come on and see me and I can help you out.
Real quick, no baby powder?
No baby powder. They can breathe that into their lungs, so that's the days of old. Get rid of the baby powder, but use all this good stuff.
You heard it straight from the doctor. Dr. Sauls, thank you so much for being here as always.
Thank you.
Well, coming up